Welcome to your pre-op teaching video for your upcoming breast surgery. This will cover breast reductions, lifts, implant surgery, and even implant removal. Well before your pre-op appointment, make sure you've completed required imaging studies. Women over the age of 35 are required to have a mammogram within a year of their surgery. If you have silicone gel breast implants, we may have recommended that you get an MRI or ultrasound as well to see if there's an underlying rupture. If you were asked to get old records, including operative reports or implant information, please try to get these to our office prior to your pre-op appointment. Smoking's not good for anyone, but especially bad for patients who are having a breast reduction or breast lift. So we require that you stop smoking or using any nicotine products 6 weeks prior to your surgery. If it was important for you to get clearance from your primary care or specialist, please have that in the works. And you're already preparing by watching this video, so that's excellent. Also, read through your paperwork, make sure you have a caretaker the night of surgery, and other things like childcare already arranged. 2 weeks prior to your surgery, it's important to stop all blood thinner medications and untested herbal supplements. Common over-the-counter blood thinners include aspirin, ibuprofen, fish oil, and vitamin E. It's also good for your body to reduce alcohol in the 2 weeks prior to surgery. Review all of your teaching material, create a question list, and start arranging for any lab work or studies that need to be done prior to surgery. We have a separate teaching video that goes over all of your prescription medications. I would watch this video prior to your pre-op appointment and then again when you've picked up your prescriptions and you have them sitting in front of you. We now electronically transmit prescriptions, and we tend to do this the night of your pre-op appointment. Likely, we will include an anti-inflammatory medication, a muscle relaxant, a narcotic pain reliever, and something for nausea. There are also a variety of over-the-counter medications that are great to have around. Most importantly, Tylenol, some over-the-counter anti-nausea medications like Dramamine or Bonine, and antacid and antihistamine like Zyrtec or Benadryl. If you're prone to getting constipated, a laxative is a good idea as well. The night before surgery, it's important to understand your NPO instructions. And what that means is the last time you can safely eat or drink. So in general, you need to stop any food or full liquids like milk or orange juice a full 8 hours prior to your surgery. You can continue to have clear liquids like water, Gatorade, apple juice, tea or black coffee, and even Jell-O up until 4 hours prior to your surgery. If you normally have caffeine in the morning, please try to get a little caffeine in your system to prevent a post-operative caffeine withdrawal headache, which can be pretty miserable. You can also start your Arnica Forte, which is the homeopathic medication to reduce pain and swelling, take your first antibacterial shower, and review your materials so you know your arrival time and place. Also make sure if someone's taking care of you after surgery that they've reviewed all of this teaching material as well. You might get a phone call from me and also your anesthesiologist the night prior to surgery. On the morning of surgery, you can take your second antibacterial shower. Don't put lotion on your chest, and it's a good idea not to wear too much makeup. Wear easy clothes like a hoodie or a button-up shirt, and bring your surgery bra with you and leave it sitting out because I need to sneak that back to the operating room before we take you back. If you're having a breast reduction, you might have also been instructed to bring a goal bra, which tells me about what size you're hoping for after surgery. Now, it is a requirement that if you've had general anesthesia, you have a caretaker with you the night of surgery. If you have implant surgery, you will go home with a card that has very important information on it. It's important that this does not get lost, and my recommendation is that it deserves an honorable place with things like your birth certificate and your passport. When you're sleeping at home, it's good to elevate the head of your bed a little bit so that it's easier for you to sleep on your back. We want your arms closer to your sides. You'll go home from the recovery room with some ice bags, and I think they're very helpful to continue using to help treat pain. Get up and walk around. You don't need to stay in bed, and take nice deep breaths to help re-expand your lungs. Most patients who are having breast surgery have really similar instructions. We want to keep your elbows kind of within about 6 inches of your side. You can bring your hands up to your hair, but we really don't want you extending your arms out or reaching high, so try to limit your activities. We think of these as little T-Rex arms, and that's a safe way to envision what you're doing with your arms. It's important to sleep on your back, as turning on your side can be really uncomfortable. This may last as long as about 2 weeks. No straining, pushing, pulling, lifting, anything heavy, and a good idea of that is a milk carton is probably all you should be lifting in the first couple of weeks. We also don't let people start their cardio for 4 to 6 weeks post-op based on the type of surgery you're having. I do have what I call the witching hour after breast surgery, and that's at about 3 weeks. And this is specifically for patients who have breast implants. I have seen bleeding complications really clustered in this time frame because I think people are feeling better and really not paying attention to their instructions. So please be extremely good about getting your heart rate up or doing any type of straining for a full 4 weeks after your surgery. In general, it's fine for everyone to shower 24 hours after their surgery. We'll let you know if for some reason it's not okay for you to take a shower. Now, you can take the surgery bra off and the pads that we place in there, but leave the hypoallergenic tape on your incisions. When you get in the shower, everything can get wet, but you might be more comfortable with the water hitting your back. After you get out of the shower, you can towel dry off and then put a cotton t-shirt on and your surgery bra on the outside of that t-shirt so that you have fresh cotton next to your skin. That can help with itchiness that occurs from the prep with surgery. Also, you'll go home with some white stockings on your legs. And if you've been up walking around a lot, you do not need to replace these after your shower. Now, after surgery, it is expected that you will have some discomfort, and it's also very common that one side might hurt a little bit more than the other. I do put a lot of numbing medicine in at the time of surgery, and sometimes this can make your fingers a little numb, so if you experience that, don't worry, it'll wear off in about a day. You'll be tired, so be sure you get lots of rest. When you look at yourself, you might see a little bit of bruising, and there may be a couple drops of blood that come through your incision onto the pads that we've placed. One of the most alarming things is the big pot belly that you'll notice, and this is especially true if you've had kids before. I promise it'll go away in a week. Having surgery makes you hold on to water weight, so you may feel like you're also puffy, and just don't weigh yourself because you'll be heavier than you were before surgery. Expect to see a little bit of asymmetry early on, and for patients with implants, sometimes you can feel a little bit of sloshing. The other thing is there's a lot of itchiness. There can be itchiness under the dressings, a little itchiness from your pain medication that you're taking, but what we shouldn't see is a rash. Itching is pretty common, but a rash that spreads outside the surgical site could be a sign of an allergic reaction. If this is happening, start antihistamines like Benadryl and Zyrtec and stop taking all of your medications until you have a chance to talk to us. A hematoma is bleeding in the surgical site, and that is also not normal. You would experience a sudden increase in pain, swelling, and firmness at the surgical site. You might also see excessive blood on the dressings and really dramatic bruising. This is usually only happening on one side, so if you are experiencing anything like this, let us know. A low-grade temperature of 99.5 might be really common, and that's usually from not breathing deeply. But a fever that's getting higher than 100.8 or 101 should be something you let us know. Now, your chest is going to be sore because we just did breast surgery on you, so that's expected. But if you're having shortness of breath and a sudden onset of chest pain, that could be a sign of a blood clot. Other signs are persistent lower extremity pain or swelling. Now, most breast surgeries don't last long under anesthesia, so the risk is low, but it's something to be aware of. Also, if you have a rip-roaring headache that doesn't go away with pain medications, hydration, and caffeine, that could be a sign of a low oxygen level. So that's also worth either checking with a pulse oximeter that you can get at the grocery store or coming into the office for a check. Some patients may have drains after surgery, and this is typically going to be our breast reduction patients and some revision breast implant cases. You will need to strip and record the output of these drains 3 times a day, and we'll show you that at your pre-op, and also the nurses can teach your caretaker in the recovery room. For breast reductions, we almost always remove these drains at your first appointment. For other patients, we like an output level of 25 cc's or less in 24 hours. Now, what's coming out of the drain is initially going to look like blood. Then over a day or two, it's going to lighten up more like red wine, then like cherry juice, and then like apple juice. As it gets lighter, you might see some little stringy white kind of fibrinous things in the drainage, or some little teeny long skinny red clots, and this is totally normal. What's not normal is if the drain is filling up very quickly with super thick dark blood that kind of looks like jello, and it might even be hard to empty this from the bulb. So that's not normal. Also, if the drainage is looking milky or stinks like trash, that's not normal at all, and you need to let us know. So there's some simple things you can do to troubleshoot your drains. What if you're having a lot of drainage? The thickness is more concerning than the volume. So if you're having a lot of drainage, but it's pretty watery, you just may need to empty your bulb more often than the 3 times a day, because when they get full, they're not you providing that suction to help with drainage. What if there isn't much coming out of your drain? Well, one thing is it may be kinked underneath your bra. It may be clogged that can be resolved with just stripping it, or maybe there's really not much to come out of the drain. So too little drainage does not necessarily mean there's something wrong. After surgery, it's not safe to drive until you've been off all narcotics and Valium for at least 12 hours. You need to use really good judgment because your reaction time isn't good when you're healing from surgery. Most patients don't drive to their first follow-up, which is 4 to 5 days after surgery. At your first follow-up appointment, be sure to bring another soft and stretchy bra that you can change into. Make sure the cup stretch and the band stretches. Sometimes you'll be in a little bigger size because having something too tight isn't very comfortable. If you have drains, be sure to bring your drain log in with you and a list of questions so we can be sure to cover everything at your follow-up appointment. Now, many patients have already stopped their Valium and their narcotic pain medications by this visit. But if it seems that you're having a problem with something or need a refill, this is a good time to talk about it. We will also review the activity instructions, such as maybe massaging your implants or what you can safely be doing at this stage during your healing. Your second follow-up is generally a week after the first one, and at that appointment, we will remove those hypoallergenic tape dressings from your incisions. If you need to do a little wound care, we'll go over that and give you some supplies, and we'll also give you the silicone gel sheeting to start your scar care. It's important that you take a couple of showers after we've removed those tapes before you start your scar care. We'll also review your activities and restrictions going forward. Congratulations, you are now prepared for your pre-op appointment. Having reviewed this material ahead of time will make you less nervous and better able to acquire new information. Please bring a list of questions to your pre-op appointment, and by all means encourage your caregivers to watch this video and also the medication guide video so they know what to expect after surgery as well. Take the time you need to heal. If you push it too much, you'll really not enjoy your recovery time. And please follow your instructions as best as possible to avoid complications during your healing phase.